Great questions, and we're going to talk with an expert about it here in just a second. John, are we going to go to... Okay, that's what I thought. We're going to bring in Dr. Amish Adalja right now, senior scholar at the Johns Hopkins Center for Health Security. Doctor, thanks for joining us again. So this changed just since the last time you and I talked. You saw what hospitals are doing right now. What are the challenges ahead until this vaccine actually gets injected, possibly on Monday?
The challenges are now waiting for the CDC and ACIP to meet on Sunday and make a decision about how they actually want to roll this out. What age groups are going to be included? Are there going to be contraindications for those people who have, for example, severe allergies like we heard from the UK? All of that's going to happen next, and then it's going to be actually implementing the rollout. So hospitals are going to be allocated a certain number of vaccines. It's not going to be their whole staff, and they have to decide at a hospital level, who of their frontline workers are they going to vaccinate first? Are they going to vaccinate and everybody with one dose and then wait for a second dose to come, or are they going to kind of spare back half of the doses? A lot of logistical challenges, that's what's going to happen. And I suspect also that you're seeing right now probably the Pfizer plant in Michigan shipping doses to hospitals and to other sites right now. So there's a lot of activity that's going to be going on. It's going to be, this is the beginning of, what's going to be a long process that will eventually end with the pandemic, but not being a public health emergency anymore.
And I want you to kind of stress that point, Doctor. As always, thank you for being with us. When we talk about it being a long process, as you just said, there's still a lot of unknowns, a lot of questions out there, but realistically, from your experience, this tonight begins a process that you think will last how long to get enough Americans inoculated that we can safely say the COVID is at least largely behind us?
I think we're looking probably at 5 to 6 more months of really trying to get this vaccine into people's arms. We're probably thinking spring, late spring, early summer before we cross that herd immunity threshold. Obviously, if we get nursing home residents vaccinated to high levels, we're going to see pressure immediately be relieved off of hospitals once we hit that herd immunity threshold on nursing home populations. They're part of the first tier, so we may start to see in the next several months a change in the perception of the risk of this disease, because we'll have hospitals not being worried constantly about their capacity on a day-to-day basis, and we'll find healthcare workers much more comfortable taking care of patients as they become vaccinated.
Dr. Pfizer and BioNTech shattering records by developing this vaccine in just 11 months. This is obviously great news, but you can understand why a lot of Americans are reluctant to get a vaccine that they don't know a lot about because it's so new. They're worried about effects down the road, 1-2 years from now. What does the messaging need to be to those people?
Well, we need to talk about what happened in the phase 1, 2, and 3 clinical trials, what we saw in preclinical studies, animal studies, and other work with the technology in this vaccine, messenger RNA or mRNA vaccines. And it's not a surprise that it was done this fast, because many of us in the field have been talking about the promise of messenger RNA vaccines to really change the way we dealt with infectious disease emergencies and get a vaccine candidate into clinical trials very quickly. You have to remember that there wasn't any kind of skimping on the safety studies. Where the speed was achieved was actually going from identification of SARS-CoV-2, the cause of COVID-19, and the development of a vaccine candidate. Then the clinical trials occurred. And anytime we have a vaccine, we don't have all the long-term effects when we license that vaccine. We follow people who get vaccinated for years. So this isn't anything different than what happened with other vaccines, other than we harnessed a new technology that allows us to kind of have a 21st century approach to making vaccines. I think we have to be proactive with this information and very transparent, because we want to make sure that as many people that are eligible to get this vaccine get it, because that's the quickest way we put this public health emergency behind us.
Let me piggyback on that, Doctor, because for people who are nervous or maybe hesitant about this thing, we will learn a lot over the next 2 or 3 months as this vaccination goes into the arms of millions of people worldwide. It'll sort of be a rolling, continual trial that we'll all be watching on the fly, correct?
Right. You have to remember that clinical trials, even though they're robust and have tens of thousands of people, don't necessarily have the ability to pick up side effects that might be happening in 1 in 1 million people, for example. And when we roll this vaccine out, and it's not just the United States, there's 5 other countries in which this vaccine has been approved, you're going to see millions of people, hundreds of millions of people eventually, and billions of people as we vaccinate the world. So you do look and see what are the rarer side effects, and you get a better picture of it. But looking at this right now, you have to make a risk-benefit decision. This is a disease that is killing 3,000 people a day in the United States, more than Pearl Harbor. And we know that this vaccine has done very well in phase 1, 2, and 3 clinical trials. So the risk-benefit ratio greatly favors the vaccine for those people who are eligible to get it. So I think that's why what we have to stress. We want this public health emergency behind us. And as I said earlier today, I would be happy to have the vaccine today, and I will likely get the vaccine next week, hopefully.
Mm. And Doctor, one of the fascinating parts of all this that we're going to see play out over the next few months is this prioritization process. I think everyone understands frontline medical workers, they're going to be the first in line, the elderly population, long-term care workers and residents there. Once we get past that first wave, though, who is going to make decisions in terms of who's next in line? Some people saying, well, school staff should be next to get the kids back in school, to free up the parents and get that part of life back to normal. Who's going to make those kind of decisions, and what should, in your opinion at least, be the order after this first wave about who gets it and when, so there's just not a national stampede to the local doctor's office or a pharmacy?
It's important to remember that this has already all been articulated by the CDC's ACIP, their Advisory Committee on Immunization Practices. So after we get through phase 1A, which is healthcare workers, nursing home residents, we move to the next phase, which is essential workers. And essential workers are going to vary from state to state because states will have latitude to decide who is an essential worker. Obviously, it's going to be people like law enforcement. It may be some political leaders that are in charge of running the government. It could be teachers, and I think it probably should be teachers considered as essential workers. To get our schools back open, people who work in food processing, people who work in grocery stores, drivers in the transportation industry, all of those are going to be the next group, that essential workers, the people who keep our world the way it is, keep our economy going, the armed forces, all of that will probably be next. And then it will be community dwelling, high risk individuals. So that might be the 65-year-old patient with diabetes who lives not in a nursing home but lives at home. Then that will be the next tier, and then after that will be the general public. That's the general blueprint that the CDC has laid out for how this vaccine will be rolled out. We'll hear more about it in the days to come.
Where do TV anchors fall on that list? Just asking for a friend.
Depends on your age and your risk factors for severe disease.
Appreciate
He's going
that.
to answer us seriously. He takes your questions seriously.
He did.
Doctor, I just want to ask you on a personal level. Obviously, it's been a rough year for all of America and the world over. But as a healthcare worker, you have such a unique perspective, and you all have been through so much more than any of us can imagine. So when you heard the news, obviously it was expected. But how are you feeling right now to know that this is the beginning of the end?
I think it's a good feeling. And not only do I take care of patients, I work in pandemic policy. So I'm somebody that's been trying to figure out better ways to make our country more resilient to pandemics and infectious disease threats. And I do think that vaccines are the ultimate solution to infectious disease problems. And to see a vaccine be made this rapidly using new technology, and what this means for the future, for our next threat, and how much better we're going to be prepared, that's what gets me even more excited than what's going to happen with this pandemic, because I do think this is going to change the face of the way we deal with infectious disease threats. And COVID-19 is going to come and go, and we're going to have another pandemic threat or another infectious disease emergency. And all that we learn here is going to make us so much better to respond. But I do think, I am excited to get vaccinated. I get excited about vaccines because I'm an infectious disease doctor and I like to be vaccinated. So I do think that this is going to be something that will get us back to some semblance of normalcy. But we have to remember that there's going to be dark days ahead. The next 90 days or so may be very critical in terms of how many people are going to die from this. And this vaccine isn't going to measurably impact that. So even though it's kind of a tempered, measured enthusiasm for where we are, but the vaccine is unequivocally a great step forward for science, for medicine, and for controlling this pandemic and preparing for the next pandemic.
And certainly the best news we have heard in months. Dr. Amish Adalja, again, thank you so much for answering our questions tonight and bringing a lot of information to the table and to our viewers. Thank you again, sir.
Thank you.
Continuing coverage now here on NewsNation. Joining us, Dr. Mark Casanova, president of the Dallas County Medical Society. He took part in the Pfizer vaccine trial and doesn't know if he got the vaccine or the placebo. He joins us right now. So let's ask you what we're asking a lot of folks like you on the front lines, Doctor. What's your personal reaction to what we heard tonight, the FDA approving this vaccine?
This is probably one of the first bright spots that we've had in our nation in the fight against COVID in a long time. So as my colleague mentioned before me, we are very excited and optimistic about this news. We do need to remind folks, however, that we still have a lot of work ahead of us. We need to maintain those safe mitigation measures until we have a critical mass of our society that's been vaccinated. But having said that, again, this is a silver lining we've been waiting for.
And Doctor, you said, I want to just drill down on that one point about critical mass. Once the ball gets rolling here, obviously this nation has a huge logistical mountain to climb over the next several months. That process is beginning as we speak. But in terms of the numbers here, we're a country of 330 million people. What percentage of the population needs to get this, ideally over the next X number of months, to get to that herd immunity so that we all can have that sigh of relief that life is getting back to normal?
Right. We would look at anywhere from a 70 to 75% vaccination rate for the nation as a whole. So that's really going to be a critical threshold. And I think what that's going to provide us, and the reality that it's going to take time to vaccinate the masses, just going to give us the opportunity to see the behavior pattern of this vaccine and ideally provide reassurance to the public and confidence that the vaccine is safe and clearly effective based on the initial data. I was able to partake in the COVID vaccine trial through Pfizer and fairly certain I actually got the vaccine based on my symptoms with the second injection. So having lived that experience, having cared for patients on a daily basis in the last 9 months, we're very optimistic, and we hope that we can bring the public along with a simple message. We in healthcare are not going to ask the public to do something we would not ourselves do, which is why so many of us took part in the vaccine trial. And while we are proud and eager to raise our sleeves and get needles in our arm in preparation for rolling out protection for our society.
Well, if you do think you had it instead of the placebo, if you had symptoms, sounds like you did, what can people expect when they get the vaccine?
Well, from the first injection, very little. As a matter of fact, I thought I had the placebo with the very first injection until late that evening. I had the very mildest soreness in my shoulder. It was the second injection that told me and many of my colleagues who are fairly certain we got the real vaccine, we'll learn in a week or so via an email from Pfizer, which group we were in. And we did have flu-like symptoms, low-grade fevers, soreness in the shoulder, muscle aches, and went to bed that night feeling fairly cruddy. So that's something we need to be honest about and aid people in understanding this is going to make you feel poorly, but that's your immune system kicking into high gear. So the irony is you're going to feel cruddy, but that's a real good thing in this scenario. And
how long did you feel cruddy?
I remember it vividly, 3 o'clock in the morning. It was as if a light switch was turned off, symptoms abated, and was at work the next day, really, honestly, feeling fine.
Wow. That brings up another interesting point, Doctor, especially since you were part of this trial. There are some who think the people, and there are tens of thousands of them around the country and the world who were in these trials, should now get the vaccine. It's sort of like we owe it to them now, having gone through what they have. But there are others who say, I guess that might impact the trial. Is that right?
Well, what the trial researchers are going to do is sort of look at the trial itself, and we do need to keep the integrity of the trial going as long as possible. When you look at the data that's been released by Pfizer, and I have a strong suspicion we're going to see similar data from Moderna, the splay in the curves, the vaccine, the true vaccinated individuals versus the placebo, there's a very stark differentiation.
Right.
In other words, I think we have the information we need. Then the researchers will need to go through a process of unblinding the study and deciding, do we do what's called a crossover? In other words, take the placebo group, vaccinate them, take the study group, and inject placebo. And certainly I'm willing to get placebo injected in my arm to complete the validity and the full scope of the study. I think that's certainly something that all of us are willing to do.
And Doctor, certainly you know this, is a divided country right now. Some folks don't think this is a big deal. It's been called a hoax by some important people in the country. There was a study out yesterday that said only 25% of African Americans would get the vaccine. So when you talk about some of the political, cultural issues at play here, this is more than just a logistical mountain to climb and a medical mountain to climb. In some ways, not to reduce it to just this, there's a public relations mountain to climb here too. How do we convince, how do you convince people that this is indeed what they should do when they're able to do it? And how difficult a task is that when you said a second ago, we need to get to 70 to 75% of this country to get this vaccine?
You're right. This is a psychosocial, spiritual, cultural mountain that we need to climb. And there's a couple of different scenarios that you just outlined. One, for our African American community, there's legitimacy in their reserve for vaccinations and their reserve for medical research and their recommendations. There's historical references and frameworks for them that would feed their hesitation. We need to, on one part, own that history and own that in healthcare and in society, and be as transparent, as truthful, and forthcoming as possible, and ensuring that, listen, there were sins in the past, but we are committed to moving forward. In general, for all comers, I really boil it down to a fairly simple binary choice. Whether you believe COVID-19 is real or a hoax, and you've been a mask wearer all the time, or you fall into some other camp, I find very few individuals that find or believe that 2020 has been a joyride. So the simple binary choice is we continue this 2020 existence, or we move forward in an effective and safe manner via vaccination of the masses. And I think if you really break it down into that simple binary choice, my hope and anticipation is, regardless of one's initial beliefs, their political persuasions, and sometimes even trust-related issues, they will come to a consensus that we need something effective to move forward.
Doctor, these may be stupid questions, but for a layperson like me, these medical questions, do we have any idea how long the vaccine will last? Is this going to become something that's part of our new normal, like a flu shot that you get every year? And also, can you be a carrier if you've been vaccinated?
So simple answers, that falls into the bucket of we simply don't know. That falls, when I said earlier, we need to be honest and transparent about what we understand and what we don't. The wealth of knowledge is rapidly evolving. What we do know is that the apparent immunity from these messenger RNA-mediated vaccines, really new, remarkable technology that has just been waiting for the opportunity to arise, and unfortunately, COVID-19 gave us that opportunity, seem to provide a much more robust immune response, even in some instances, than the viral infection itself does. So there's some optimism, initial optimism I need to emphasize, that not only will the effectiveness be robust, but that the longevity of protection may be long-lasting. More to come on that. In terms of the annual vaccine or booster shots, we're going to simply need more information. An issue of being a carrier or acquiring the vaccine or acquiring the virus, but being asymptomatic in that context, that's a possibility. That's a theoretical possibility. And that certainly happens, for example, with seasonal influenza, the flu shot. You can get the flu shot and still acquire the flu, yet you tend to acquire a much more milder case. So some of this is going to vet out, and that's actually a great question, because that's all the more reason that we need that critical mass to achieve herd immunity.
Dr. Mark Casanova, president of the Dallas County Medical Society. Fascinating insight from someone on the front lines of the healthcare industry and on the inside of the trial itself. Thank you so much, sir, for your time. We really appreciate it.
Thank you. Be safe.
Cheers.
And make sure you download the free NewsNation Now app to get the latest headlines regarding the coronavirus vaccine's rollout across the country. We also have full coverage of COVID-19 at newsnationnow.com. We'll be right back.